The four-way test. Rotarians, please always rise for the four-way test of the things we think, say, or do. First,
is it true?
second,
Is it fair to all concerned?
third,
Will it go well and better friendships?
fourth.
Will it be beneficial to all concerned?
Thank you. Please be seated. The Rotarian song. May we have PP Ab to lead us to sing the Rotarian song.
My pleasure. Hello.
Hi. R-O-T-A-R-Y, that spells Rotary. R-O-T-A-R-Y is no pregnancy. From north to south, from east to west, a province more who serve the best. R-O-T-A-R-Y, that spells Rotary.
Thank you.
Thank you, PPA. Introduction of visiting Rotarian and honorable guest. May we have Irene.
Hello, good afternoon. And today is our honor to let me introduce our speaker is Dr. Hoàng敬. And today we have one guest is Joanna, and she's from Netherlands Rotary Club. And Joanna will also join our chartering. Okay, welcome.
Oh, wonderful.
Thank you, Irene. Welcome visiting Rotarian song. Joanna, please stand up again, and may we have PP Ab lead us to sing the song.
Welcome, sir. Welcome.
Yes, oh Rotary, we greet you. Oh yes, oh Rotary, we greet you. We want you to feel that our friendship is real. We are glad you're here today. So take back home a bit of cheer. Regards from all the fellows here. And once more, you are near our door. Come again, Rotarian, come again.
PPA. Present time. We have President.
Yeah, thank you everyone. So we have a very good week. Thank you DB Fire and Sue that we hold a charter informal meeting, a charter group hold the informal meeting in Sophia, a very good restaurant. We have a very good time. You can see a lot of kids over there and everybody really have a good afternoon. And at that day we organize all the music player in the same time, and I think we're gonna have a very good charter night, so welcome to join us. Next one. Okay, so the badminton team is still rolling. All right. Okay, that's my part today. Thank you.
Secretary time. May we have PP Robin to give us a short presentation about the community service.
Good afternoon, dear Rotarians, and this is one of our community service issue. There's an English contest about 2021, and we are the co-holder with Taipei Club and Kaohsiung Lighthouse Club. And the purpose so we want to. The topic is youth managing COVID, and the candidate is the college student, and yeah. And next, please. And the deadline will be 21 February the 19th, and it's the registration deadline. And the first prize will become to next prize. The first prize will come to 50,000 NT. So anyone you have the family or friends that can register before February 19th. Yeah, that's my report. Or the president have some.
Thank you, Fifi Robin.
Yes.
So let's detail. So to add some information, we under PP Bio, PP Juice, and several PP support that we trying to have a close relationship with Rotary Taipei and Rotary Lighthouse Kaohsiung. And this event is the Taipei Rotary Club. They hold this kind of English test around 60 years long. So this is the first time. This year is the first time we work together with the Rotary Taipei Club. And right now there are already 29 teams, college student teams registered. So we hope that more students come to join this competition, especially from Taichung and Kaohsiung, the southern part of Taiwan. So if there are any relationship or you have any relationship to the college or the university, please offer us some information. We hope more students join this competition. And this topic this year is quite interesting. They want students to speak English, to say some resolution to solve the social problem. So I think it's gonna be a very, very good and interesting contest. So that's my part. Thank you.
Thank you.
Thank you, Phoebe Robin.
Thank you, Phoebe Robin. Okay, general board meeting will hold after regular meetings. All the board members, please reserve your time. Okay. Speaker introduction. We have Berto.
Good afternoon, everyone. And it is my honor and pleasure to introduce my good friend, Professor Huang. And Professor Huang graduated from Yangming University Medical Department, and he has been a doctor at Wheaton General Hospital and Taipei and Taichung. Now he is a chief doctor at China Medical University, and he's good at the operation, AI and microsurgery. Today he's going to bring to us a very, very informative speech. 那怎样吼？过50岁了吼，什么东西都软掉了，上面电呢吼，射物线越来越短的路电然后呢，血管越来越电还有那个什么，馆长越来越电所以怎么样子保健，我想就 very, very important 谢谢。
Okay, ladies and gentlemen, good afternoon. I'm Dr. Huang. Thank you, Dr. Lin's kindly introduction to me. It's my first time to give a talk here in your party, and it's my great honor to be here. Today, I would like to share my clinical experience about the urinary tract. We say the kidney, ureter, bladder, and the prostate, and also some disease about the male genitalia like testicles. It's my first time to ask to present with English in Taiwan. So a little bit stressful. More than every major operation before, yeah. So I did not have well English talk training before. but I think I can give some my experience to you today. Now I'm leading the Department of Urology in China Medical University, and also have some part-time in Asia University Hospital. I'm graduated from Yangming and get a PhD degree in China Medical University. My major clinical practice is surgery. You can see, this machine is a Da Vinci. I think everyone will know it's very rare. Its stock is getting higher as Tesla. Yeah. So today I would like to show the new technology applied in urology field and how about the common disease maybe you will face in about the urology disease and how to prevent to see a urologist. It means how to keep your health to prevent get BPH or some cancers. Yesterday next. Okay. Before starting, I will also share my pleasure that our team just gets 2 certificate of symbol of national quality yesterday in Taipei, Xilaidan. It's about the robotic surgery, about the high-risk prostate cancer robotic surgery. Our team gets the quality confirmed. And also another national quality symbol is kidney cancer. Our team used the robotic to do the robotic partial nephrectomy for very high-risk kidney cancer. Our results have been confirmed by our national quality team. Yes. Okay. How about? Okay. You may maybe think I'm still young. I have working for this field for more than 20 years. So I get some award here, and it's not important. That's our focus today. So today, I would like to show the most common cause that the patient will come to my clinic is hematuria. This means you see your urine turn to be red color. So it's a major symptoms of disease about our urinary tract. And second, we will talk about the kidney, how to get your kidney health, and how to keep your bladder, your prostate, and how about the cancer of the urinary tract. Okay. This cartoon figure, you can see our kidney, from the kidney and the ureter to bladder to our kidney produced our daily urine, and so it's very important. And when you get a problem with your kidney, you may see 2 kind of doctor, urologist and a nephrologist. Which problem you need to see the urologist? Urologist is a surgeon, so if you got the disease, you maybe need to do invasive treatment. Then urologist, you need to see me. And if you got renal function impairment, you find your renal function loss. You have not cancer, stone, or other structural disease, you need to see a nephrologist. it will suggest you how to keep your good renal function. Okay. Next. Okay. First, we see when we see the patient come to my clinic. They give me the data they have microhematuria from the health checkup. This means your urine have blood in your urine. It's like take for example, our bladder like the pool, and you got urine from you got the blood in your urine. Maybe the blood is from the urethra, your urinary bladder, or the upper tract, urinary tract, kidney or ureter. So we need to find the origin of the hematuria. Next. Okay, this is a simple anatomy. Any simple?
有可能你的手去 touch 到你那个遥控器。
Okay. I think I don't use it. Point. Okay. This is a simple anatomy of our urinary tract.
Okay.
Okay. You can see kidney, ureter. Oh, this screen cannot be touched. I see. Okay. Okay. So the urologist care about very many organs in your body. You see the kidney. What's wrong? Kidney, ureter, bladder, and if you are male, we got the prostate. For female, she did not have prostate. Yes. Besides all these organs, there is also a small organs just above the kidney. We call it adrenal gland. Adrenal gland is also a very important metabolic organ in our body. It control our blood pressure and electrolyte. It's like here, the yellow colors. So once you got the tumor over the adrenal gland, you also need to see a urologist. We will do the surgery for you to remove the tumor. One hypertension patient in 100, they got the hypertension patient has a tumor in adrenal gland. Yes. So if you remove it, then the hypertension can be completely cured. Okay, I'll focus on the kidney, the bleeding. I say the blood maybe from the most upper portion is kidney. It's maybe from the trauma, stone, infection, and tumor. All these causes may lead to hematuria. So our responsibility is to find out the cause of the hematuria. The most common cause of the hematuria from the report is stone. In Taiwan, maybe patient has tiny or large stone. Some stone in your kidney, you will not feel discomfort or pain. When you got sharp pain over lower area, is because the stone migrate to the downstream, like to the ureter, and cause the obstruction. Then you will feel discomfort. Once the stone in your kidney, you will not feel any feeling. But when you do the ultrasound, your X-ray, maybe you can find the stone. But the stone in this disease is most safe. It's usually not have a stress to your life. But you got the infection, acute pyelonephritis. It's a kind of very severe infection of your kidney. It will sometimes lead to sepsis. It means your blood pressure will drop down quickly. If you did not receive the antibody and the fluid supplement, you got may even go to die. Yeah. But in my field, we most care about cancer. Renal cell carcinoma and urothelial carcinoma is two different kind of cancer. In Taiwan, 1 year, about 1 to 2,000 patients will get renal cell carcinoma, and another thousands will get the upper tract UC. But for trauma, it's very less case will get blunt injury from the kidney. Okay, let's start. Yes, thank you. Okay. It's a kind of stone, huge stone in your kidney. We say that stake home stone, like a stake home. It's the stone occupied all the space of your kidney brain system. If you did not treat it, then your kidney may decrease the size, atrophy step by step. So it's a most difficult case for the kidney stone. I use robotic surgery to remove the stone. Yes, to open the kidney and remove the stone and the suture quickly. It's innovative surgery here in Taiwan. Also, maybe just I have the experience to do this. Okay. This about the tumor. As I've said, there is two kind of kidney tumor. So, one is renal cell carcinoma, another is urothelial cancer. In the Western country, most patients, they say the kidney cancer, they are renal cell carcinoma. Because in the United States, in other countries, they have very few cases of renal urothelial cancer. But in Taiwan, we have very high instance of the renal cell carcinoma, of the urothelial cancer. It's maybe located over the renal pelvis or ureter. All this we call that upper tract UC. It's because we go to the in Taiwan we have some carcinogen like erythrotic acid, 马多磷酸. It's existed in some kind of Chinese herb, but have been completely prohibited decades ago. But still, the instance did not low. So maybe some herb or some food, some other factors still exist in Taiwan. So we have high instance of the UTUC in Taiwan. The renal cell carcinoma, the course is the instance is equal to Western country. Next, please. For the tumor, early stage, all the cancer, early stage, we can remove it completely, and you can get complete cure. Yeah, this for small, early renal cell carcinoma. Even you got 3 tumors in one kidney, we still can use the robotic surgery to remove it and quickly and completely. We don't need to have a big surgical wound on your abdomen, just a tiny 4 to 5 choker wound. Yes, it's a very long-term ago history. Yes, 6 years ago. This cartoon means how to do the surgery. It's not important, but before the minimal invasive surgery era, we do the surgery. We need to open a big wound and prepare ice to cool down your kidney, because all our organs, when you lower the temperature of the organ, we can keep the kidney ischemia for a very long time. When we do the kidney transplantation, we get a donated kidney from Taitung and sent to Taichung. Just we need to put the donated kidney to another recipient within 24 hours. If we keep the kidney in the ice box, it's okay. So when we do the surgery, we need complete clamp the vessels of the kidney and do the excision, suture, multiple layer suture. So if we put the kidney in an ice pool, and we can do the surgery slowly, meticulously. But in robotic surgery or laparoscope, you cannot put any ice in your abdomen. So we just have just 30 minutes to finish all the procedure. We were very stressful, but not higher than here today. Okay. Here you can see we removed all the tumor, include one adrenal tumor. There are 3 renal cell carcinoma. Another is adrenal gland tumor. So we just in one surgery to remove. And this patient has followed up more than 7 to 8 years. It's okay. Yeah. So it's about the kidney tumor. So you got a tumor in your kidney. We don't need remove all the kidney. Just before, maybe decades, years ago, you find a kidney tumor, 2, 3, 4 centimeters. The urologist will say, hey, would you like to remove it to complete? But now you may have another choice to preserve your kidney. Even the tumor is up to 6 to 7 centimeters. I can do the kidney preserve. Because you preserve more kidney, you can prevent the hemodialysis in the future. Yeah. But for very huge, late stage renal cell carcinoma, you need to remove all the kidney. But for this case, this is not my case. I can do the partial nephrectomy, the preserved kidney. But some patients come here, they have low back pain, hematuria. We do the CT, we can see the soft tissue density over the big vessels is lymph node metastasis. It's end stage, stage 4. This don't do the surgery, you cannot completely remove all the tumor. You need to do the chemotherapy, target therapy, or immunotherapy. Now, immunotherapy can be used in almost all kinds of cancer. That is include renal cell carcinoma. Okay, so here I say stage 3, 4 renal cell carcinoma we can do all the systemic therapy, but when the tumor shrinkage and the lymph node disappear, for some cases, we still can do the radical nephrectomy to remove all the kidney tumor and include the lymph node. Yeah. Okay, this renal cell carcinoma. Now come to the renal pelvis UC. I said it's very popular in Taiwan. There is a study here. For all the uremia, the end-stage kidney disease patients in Taiwan, they have more than 40 high risk, 40 times high risk than the normal patient. They will get the urociliary cancer for uremia patient. So when you have family or friend, they do the hemodialysis every week. You need to check his urine ultrasound every maybe 6 months. If got hematuria or some kidney disorder, then you must make a more detailed examination to rule out the upper tract. So the UC is also very, for early urociliary cancer, we can do the whole kidney, ureter, and bladder cuff excision to cure the cancer. Yes. So most of my patients receive robotic surgery, or you can do the more less expensive laparoscopy, or very, very few patients will choose open surgery. But also some cases we need to do the subsequent chemotherapy or immunotherapy, radiation therapy. Yeah, so the hematuria, the second cause is ureter tumor. The therapy method is the same as the renal pelvis. So the same. It's a tumor in this tract. Also, we can get a flexible scope to make a diagnosis of the urociliary cancer and do the surgery to remove all the kidney, ureter, and the bladder cuff. So, but for some cases, they a poor kidney function. If we do, and also they come to my clinic have bilateral UC. If you tell him you need to remove all your kidney ureter, then he or she need to receive the hemodialysis just after the operation. They cannot receive the suggestion. So some cases, if the tumor is tiny and early stage, I may also use the minimal invasive laser combined with the flexible ureteroscope to ablation the cancer just in the ureter, and can keep one side. Another side, more severe side, we will suggest to remove it. Yes, so there are some methods to preserve your kidney, just like the previous, I said, the renal cell carcinoma. You don't need to remove all the kidney like that. Okay, and come to the bladder. Bladder cancer is the incidence about the 2,070 cases annually here in Taiwan. Just because bladder cancer is easy to be discovered because it gets hematuria more easily. So about 80% patients get early stage bladder cancer. Just 20% need to remove all the bladder. You will lose his urinary bladder and need another way to divert his urine. Just like this staging. It's early stage bladder cancer. We just need a urine endoscope to resect the tumor. But for the cancer invasion to the muscle layer, stage 2, 3, 4, we all need to remove all the bladder. For male, we need to remove the prostate as well. Then the patient usually do not have good quality after doing the surgery. This early stage can do the transurethral bladder cancer resection, just followed by some BCG. You know, BCG can be used in the bladder cancer for more than 40 years. So urologist is the first group to use the concept of immunotherapy because we put the low toxic BCG in your bladder. It will induce the local immune response. All your lymphocyte, macrophage, natural killer cell will come to your bladder to kill all the tiny cancer you cannot see under the scope. So it can reduce the recurrence rate after. But you need to come to my clinic every week just for at least 6 times and follow the cystoscope and frequently. And also you can put some chemotherapy in your bladder after the early stage resection of the bladder cancer. But for middle stage, you need to remove all the bladder system. Open surgery, you can get a big wound. Big surgeon, big wound is a long time ago. Now, small surgeon, small wound, yeah. So the laparoscope, but the Da Vinci is still a very useful tool to do the surgery. So we need the surgery. Also, some patients cannot tolerate surgery. We will do the radiation to the bladder or chemotherapy, immunotherapy. Yes. When we do a cancer, I think you have experienced many talks about the cancer. So you need the neoadjuvant and adjuvant. It means the chemotherapy you put just in front of surgery or after surgery. Yeah. You see, age is always not a boundary of the surgery. This age, the patient is over 82, yes. He got all his urinary tract organs cancer, kidney, ureter, bladder, and the prostate. My system all he got 4. Yes, but he's very brave. his son asked him to do the surgery because all the cancer had not spreading to lymph node or bone or other organs. So I thought, even you are aged and you are undergoing the hemodialysis, I say your heart is still good and I can do the surgery for you. So use Da Vinci to remove all his urinary tract. And he survived very well for a couple of years after that. It's 7 years ago. Yeah. Okay. After all the cancer, we still all the male have the big problem of the prostate after maybe 60 or 70 years later. We got the prostate here, and the prostate the size will increase step by step because we have testosterone to stimulate, and we have some diet, maybe fatty acid content food, some or your family history have BPH. So all kinds of factors that make your prostate large. So its incidence is very high. For 60 years old male, they got maybe 50% BPH. But not all male need to get pills when he got the BPH. Some patients can tolerate his voiding status here. So we got many about the BPH surgery. Use the laser, green light laser, toluene laser, red light laser, many kind of laser. We can use the laser energy to your prostate instead of traditional knife to cut your prostate tissue. It's easy to get bleeding and during the operation and post operation, and the recovery time is longer than laser. So it's a laser surgery. It's also minimal invasive surgery. Yes, TURP and its advantage, the traditional transurethral resection. The advantage is a gold standard for decades, maybe of 50 years. Yeah, and our national health insurance covers this surgery. Yes, but the disadvantage is busy bleeding, and sometimes you will make your sexual function loss because the energy, the thermal injury, our sexual nerve and the muscle just very, very close to our capsule or prostate. So once your energy and the thermal injury to the nerve, after the surgery, you will, why my sexual function is lost? It's about maybe 20% risk. Yeah. But the laser is the advantage of laser is less bleeding. It's every time the nurse asks me, they need to record bleeding after surgery. I say 1 millimeter. Easy. And quick recovery, you just need to stay in the hospital 1 or 2 days after surgery. And sexual function can preserve more well. And but the advantage is expensive. Not NHI did not cover this. So the most important here, but is prostate cancer. The incidence of prostate cancer is rising year by year. This year, the incidence is over 7,000 patients, new cases in Taiwan, 7,000. Yeah. For male cancers, in United States and other Western countries, prostate cancer always ranking is always number 1 or number 2. Taiwan also the ranking is rising. Yeah, in these years. Prostate cancer, we have most people will think it's not a very serious cancer. I have a friend, he have survived 10 more years, but still about 1 to 10 10 to 20% of prostate cancer, you will die quickly, just within 5 years after diagnosis. So we cannot ignore the prostate cancer. It's very easy to diagnose prostate cancer. All the cancer in our body, you cannot find a very good prostate cancer, very good cancer marker. But prostate cancer, you got a PSA. PSA, the sensitivity of PSA for prostate cancer is very high. It means once you got the prostate cancer, your PSA will show high. But for liver, for colon, for pancreas, other organs, you just rely on the tumor marker. It's very dangerous because maybe much portion of the cancer, you will not see the tumor marker get high. But for prostate cancer, you just need to check the blood for PSA just for seconds. They can get your health. But when you got a high PSA, don't worry too much. It has high sensitivity but low specificity. It means if your PSA show high, don't worry. When your PSA level is 4 to 10, the cutoff level is 4. Remember, from 4 to 10, a little bit higher than normal range. The prostate cancer risk is just about 20 to 30%. So don't worry too much, but you need to do more examination and follow up to check if you got prostate cancer and ask the expert. It's very important. The PHI is a new marker, more sensitive than PSA, but it's also very sensitive to infection. So some young guys, maybe just 30, 20 years old, young boy, they got a health checkup. They check the PHI. Wow, I'm normal. Dr. Huang, I have risk of prostate cancer. Don't worry too much. Prostate cancer, prostate cancer patient in Taiwan or in all the world below 50 years old, the percentage is just about 1%, 1 to 2%, very, very low. Just below 40, it's very rare, maybe just cases. So, but when you are aged, you need to take more care. So, I suggest that when you age over 50, if you never get the blood test for PSA, go ahead to check it. And if you got a family history, your daddy, your uncle, your brother has this problem, you need to check the PSA more earlier. In Taiwan, we suggest that you need to check PSA at 45. In America, United States, they suggest 40. If you got a family history, you need to check PSA 40. In United States, the label of the PSA, they say 3, not 4. So in United States, they got more prostate cancer patients at a very early stage. 80% prostate cancer in United States now resectable. They can do the surgery. But in Taiwan, just 1/3 patient is early stage, 1/3 is middle stage, and 1/3 is meta disease. It's a little bit shame when we talk with the United States doctor. Oh, you have so many patients with prostate cancer with metastasis. So, because our government did not suggest PSA screening, so you have screening, chest X-ray, stool, and the breast, and the lung. You never see a checkup regular PSA. Even the NHI covered the annual aged male patients' blood test did not include PSA. So you need to tell your doctor, I will check PSA. By the way, yeah. And also, the digital examination is very important for urology experts because some patients they have low PSA, just 3.1 or 2. I can touch the prostate cancer nodule from the anus. So if you come to see me and I check the digital examination, and you can find the cancer more earlier than others. Yeah. So finger is still very useful, and the transrectal ultrasound is not reliable. It cannot find the cancer. It's just used for check the size of the prostate. If you want to know your size of the prostate is bigger than a golf ball or something, you can do the trans. And once you got the risk of prostate cancer, urologist will suggest you do a biopsy, transurethral biopsy, transrectal ultrasound guided biopsy. It's a kind of invasive procedure, but it's a gold standard to make sure you got prostate cancer or not. Yes, time is limited. Yeah, okay. And besides this, we have a multi-power MRI. Parametric MRI now is a very sensitive tool to check if you got prostate cancer. The specificity is up to 85%, more than this trans biopsy or digital examination of PSA. But you need to do by self-paid. This digital examination, ultrasound, yes. Okay, it's a surgery treatment strategy. Surgery or HIFU and is a non-invasive surgery, but not as good as the robotic surgery. But also you can do the radiation. Or if you got a metastatic disease, you can have good hormone therapy to control the prostate cancer, but not for everyone. This is robot surgery. You can see you can do a very very good surgery with this machine. Yeah. Laser surgery. I said that this mirror has more than 100 years. He got prostate cancer and the urine retention. He cannot go away by himself. We use the laser to make him reduce his prostate volume and make him pee very well. Now he still can enjoy. He can ride a bicycle when he aged at 100 years. Yeah. And all these other cancer is more rare than these 4 cancers. So because time is limited, did not introduce this cancer. Yeah. These other congenital, benign, not cancer cases, we still can use minimal invasive surgery to do his. Yes, you can see we do the surgery. You can sit on a very comfortable table. Yes. Even I got a cold, a very severe cold, I still need to do surgery. So I need IV fluid, but I can do the surgery very well. This case, yeah. Okay, the most important, just 3 minutes. You need how to preserve your kidney function. Just number 1, adequate water intake. About maybe 1,000 or 2,000 millimeter of the water, and avoid the use unnecessary pills. Some painkillers will injure your kidney and liver, and control your blood pressure. High pressure and low pressure both is not good for your kidney. If you control your blood pressure too low, your kidney will not get adequate perfusion. The function will lose. So sometimes the patient get too low pressure, and your lipid, sugar, and good urination habit. You need to go to pee frequently don't hold your brother to emergent. And regular health checkup is most important. And check your renal function, your urine, your ultrasound kidney. It's very, very easy, can take care of your urinary tract. And for your bladder, you need to assess the carcinogen, include nicotine, smoking, as a cyanic, yes, and a aristogenic acid. And be careful cystitis or some bladder overactive bladder. Because you got this problem, you will make yourself drink more less water to avoid go to the pee more frequent. But it's not good for your bladder and your kidney. And for food, prostate, you can get more unsaturated fatty acid and sodium, protein, carotenoid, lycopene. It's good for prostate. Vitamin E. Yes, these factors is reported in the paper to make your prostate more healthy. And phytoestrogen is also good for prostate. Yes. And we take the calcium, daily calcium, don't take too much calcium. Sometimes it increase the prostate cancer. Yes, this is the last message. Keep your diet more healthy and low oil, multi-fiber food, and water intake adequate. More exercise, less nicotine, less alcohol, less stay up, and most important, regular checkup of your body. Okay, thank you very much.
Take picture together. Thank you for your attendance.
Thank you. Thank you, Professor Huang. And